It's an interesting evolving prototype. The bringing together of Indiana University and IU Health on a non-medical campus for a new prototype for what is a academic medical regional hospital or health campus is unique. We don't really know of an example like this, and I think that synergy to deliver both education, in a limited way research, and most importantly clinical care to benefit the residents of Southern Indiana is really special. We have strength in first of all, the front-end planning, organizational planning, operational planning for healthcare, and that moves into programming. We do a lot of, have to obviously decide the number and kinds of rooms. We do that. Medical planners who lay out the various sections of the building, building designers who give form and texture to the buildings themselves. We have folks who are specialists in the interior design so that they give life and vitality to the spaces. We have a whole group, planning group of landscape architects and urban planners that obviously this is a 70-acre site. The notion of the outdoor spaces, the roadways, the creation and enhancement of what's a very beautiful site is needed, and those landscape architects play a key role. So we have, as one of the benefits of a large firm, we have specialists that work together in a collaborative team way to create what we hope is magic. So we're doing a lot of upfront planning work and frameworks for where buildings go on the site, where they're located to provide open chairs, if you will, to allow expansion in a number of different ways. Within the buildings that we build, we're going to be incorporating flexibility concepts with allowing a certain amount of change to occur in an easy manner. The notion of what a hospital is evolving, and in some ways it's narrowing and shrinking. There are care settings, and we're really breaking that down into two primary venues, those planned events and unplanned events. And the unplanned events are obviously things that you can't predict, a sickness, a heart attack, a car accident. Those will always continue. The planned events, which are more ambulatory in nature or population health in nature, are expanding, and there's a shift to those, and some of those are going to be in a care setting on this campus, and then many of those will ultimately be migrating to the home or to places in the community. We listen to the staff and really physicians, the clinicians, all levels of staff. We're also trying to get people to imagine doing it in a new way. We're not just trying to actually say, okay, well, how do you do it today? What's good about that, and let's do that. Because that would just be staying where you are. We're actually trying to get people to think conceptually about what are the aspects of what they do now and how can it be made better. We've all sort of been in hospitals and received care. What do you remember about the care? It's more about the people than it is about the place. You know, look, I'd go for the best care at not such a good place than not good care at a beautiful place. Now, we're trying to bring together both, but the notion is that if we can enhance the environment for clinicians and caregivers to be innovative and to be comfortable and to be happy and to have their needs met, they will provide better care. And if they provide better care, there'll be better outcomes. And it's better outcomes that we're after.